outline in our resources. So off we go. So I want to start with introducing myself. My name is Marina, and I work with the Stop TB. I work here in Geneva in the TB Reach Secretariat, and this morning we are going to discuss including empowerment of women and girls into TB Reach Wave 7 grants. So if you are on the wrong webinar, this is what it's going to be about. So welcome. Here is an outline of my presentation. We will start by having a bit of a discussion around what empowerment means. We will then continue to explore how and why empowerment of women and girls can be included into TB programming. And we will also talk about the framework we have developed and how the projects can implement it. At the end, I will go over the questions that were sent in. I expect this to take about an hour. There is a lot of participants. If we have time at the end, maybe we can do a quick discussion. If not, unfortunately, we might not have time for that. So I want to start with a little exercise that I hope will get us to open our minds. If you could please go to this website, so you just enter sli.do into your browser on either your computer or other device that it's internet connectivity, and you enter this code. Let me show you how to do it. So you go here, and then you enter code 8871, and you say join. And once it loads, can somebody, I don't know who is not muted, but one of the participants doesn't seem to be muted. Could you please mute yourself? So there's a question here, and it says, what does empowerment mean to you? So please take a minute to enter your answer here. And we will see what comes up. So far, I only see one answer, so perhaps people can be a little more proactive. Okay, 2. I'll give you a little bit more time. So again, if you're just joining, you're going to SLI.do, and you're entering code 8871. Sorry, let me share my screen again. So 8871. And we're looking for some answers to this question. And I'll give you another minute, and then we'll proceed with everything else. Look, we have a word cloud. So this is what you think it means, and there's some words around power and authority and making people stronger. Decisions, I see skills, potential, independence. So there's a lot of good words here. All right. So back to the presentation. If we were to look up empowerment in the dictionary, this is what we would see. It's the process of becoming stronger and more confident, especially in controlling one's life and claiming one's rights. Some have defined it in other ways. It's the ability, some have defined it as the ability to make choices. And I think from what we just saw, you know, we all have different, slightly different, but similar definitions. When we talk about empowerment of women, we usually mean this. And the key point here is the ability to gain control over one's life and participate in making decisions that affect them at home, in the community, in government, and international development policies. And I think our word cloud kind of captured all of these ideas. So very impressive. So I'm sure all of you have asked yourselves the question, why women's empowerment in TB? We have been asked it many times, and our answer is always, why not? Gender equality is a part of sustainable development goals, and WHO and TB strategy doesn't mention it exclusively, but it discusses protection of human rights, ethics, and equity as one of its key principles. We know from other work and experience that if girls are empowered to pursue education and careers, societies where they live benefit. We know that empowerment is beneficial for economies. We believe that it may be difficult to impossible to eliminate TB and HIV without focusing on gender empowerment. And we think that more and more programs will be focusing on this, and we're proud to be rethinking the TB response with you in this wave and possibly beyond. The government of Canada has been a champion for women's rights and empowerment, and TB Reach is largely supported by Foreign Affairs Canada. This paragraph relays the vision of the government of Canada about the Feminist International Assistance Policy. I particularly want to encourage you to review the last sentence of this paragraph. I think this is the least we can do, is engage women in decision-making around programs that benefit their communities, for example. So in this presentation, I do not plan to talk about TB epidemiology. TB epidemiology is something we always talk about when we discuss gender and TB. It's possibly the first thing that comes up when anyone mentions women or gender. We all know that less women than men fall ill with TB. Less women are missing, meaning that the gap in case finding for women is smaller than that for men, and so on and so forth. That is why if you're proposing an intervention that focuses on case finding among women, it has to be adequately justified. And that is why this is not the primary focus of either Wave 7 or this presentation. Oh, somebody is not muted. Can you please mute yourself? Thank you. What we rarely talk about when we discuss gender and TB is this. We don't talk about the fact that empowerment of women and girls is not a standalone item. It's something that it can and should be done as a part of daily interventions in communities, and it benefits anyone. It is also that why epidemiologically women might not experience the same level of severity of TB as men. They face worse socioeconomic challenges. For example, women are more likely to be malnourished, illiterate, reside in extreme poverty, be involved in providing care to partners who are sick with TB, parents who are sick with TB while caring for children and running a home. And women and girls generally face more stigma at community level if they have TB. These impacts of TB on women and socioeconomic risks of TB to women are often not recognized. These impacts are also significant in how communities address TB. I want you to think about this. If women are carrying the majority of the caretaking burden, but are never asked or requested to provide input into how programs are implemented, are we ever going to be able to stop epidemics? We also know that in many communities where we work, the majority of the health workforce and the majority of the TB workforce is female. And generally, they're either unsalaried as volunteers or underpaid as community health workers. So hopefully at this point, it's a bit easier to see why empowerment of women is not so distant from TB program implementation. TB Reach invests in ground-up approaches proposed by local community organizations. These organizations often have incredible insight into the most underserved communities where inequities, including gender inequality, are rampant. We see an opportunity in this. Organizations that we work with often are acutely aware of what happens in communities where we work. We get reports of fathers being hesitant to bring their daughters in for testing once TB symptoms are identified. The belief in these communities is that if a daughter has TB, she will be unfit for marriage. We hear from community organizations that women do not access care if their husband doesn't permit them. We hear that there is violence in the families if the wife is found to have TB. Organizations we support work closely, very closely with communities and know all of this, but little is done to document it or address it. We're not counting on TB organizations to become experts in domestic violence prevention, for example, but we're hoping that some critical thought is given to what happens on the ground and what can be done with existing skills, resources, and networks that your organization already has. So what are we hoping for? We recognize that change is incremental and it might be difficult to ignite real change over the course of 12 to 18 months. Yet we want you to try. We're looking for critical thinking, innovation, and real outcomes. We also call on you to try and challenge the norm. To help applicants, we have developed this framework. It is available on our Wave 7 website and under additional resources, and we will take a look at it towards the end of my presentation. This framework represents a relationship between data and evidence, creating gender-responsive programming and promoting gender equality through empowerment. Basically, we can work towards empowerment by trying to understand the situation through data, starting to respond to the evidence and gaps by creating gender-responsive interventions, and hopefully creating some opportunities and choices for women in the community, which would add up to empowerment. This is the closest we have to a formula that may start shifting TB programs towards empowerment of women and girls, gender-responsive programming, and approaches. We're hoping for projects to adopt this framework and attempt interventions that will have an impact on all three of these categories. So what do we mean when we say looking at data and evidence? Why do we need gender disaggregated data? Let's look at these hypothetical charts and say, you know, at the first look, it looks like more of the same. We knew this already. More men have TB. But when we start looking closer, we can say, wait a minute, we have a higher portion of women not reaching testing from those who were symptomatic. And similarly, we have a higher proportion of women who were diagnosed but not starting treatment. We also see that men are less likely to finish treatment. I said that this data were hypothetical, but I have to add that when we started disaggregating the data, some of these same issues came up. For example, in several projects, more women are not reaching testing and dropping out prior to treatment initiation. We need to know the data and evidence in order to make decisions about program design. The TB data projects collect should be gender disaggregated, but there is other data projects can look at too. Other challenges for women in terms of moving around their communities. What are the rates of violence? What are other services that women may be getting where there's an opportunity to collaborate? These data are not usually something TB programs look at or think about, and we want this to become a part of our practice. So hopefully, once you've looked at your data, you can also begin formulating a gender-responsive intervention. We can look at data in each step. What are the challenges for screening? What are the challenges for diagnosis? And what are the challenges for treatment? And we can start thinking of why these challenges are occurring. Better yet, we need to talk to the community and see what they think. We're very likely to find out something close to what is already here in this table. But also, every community may be different, and there may be some specificities that are particular to your work. Based on what we find, we can start adjusting on how to deliver our programs. The question, however, still remains: how do we jump from this to empowerment? We have our data, we have talked to the community, and we might be able to come up with a solution. But how do we go from this to empowerment? So unfortunately, there's not really a formula. Again, in our framework, we provide a list of ideas, a list of how to measure, how to do this jump and how to measure and some of the impacts that can be made. We hope that by looking at some of the data, holding community discussions, organizations will be able to identify some opportunities that can be partnering with women's organizations, training more women in community health councils, to providing training in TB screening and diagnosis that also includes some work around empowerment of young girls. These are just examples, and then the organizations attempt these and broaden this list. There's a question that came in very late last night about partnering with HIV and other organizations that already benefit women. And since it's the first bullet point on this list, I want to particularly mention it. As much as possible, we want to encourage you to look at structures that already exist in your communities that benefit women and attempt to collaborate with them. We hope projects will try some of these approaches or come up with others. I realize that examples on this slide have a lot to do with employing women. There has been a few questions submitted about that as well, but let me be clear. Employing female health workers is not innovative or empowering. It is done routinely everywhere we work. We would like to see how your project actually empowers or provides additional opportunities, access to decision-making, and choices for women through this work. So if you're recruiting female volunteers, how will they be supervised? And if not money, what will they receive in return? How will they be empowered? Also, if you're recruiting girls and young women, but stating that your communities are not safe for them to move around freely, how is this challenge going to be overcome? What work at the community level needs to be done so it's safe for these young women to move around? We want solutions that make sense in your local environment. I will now go through some of the questions that we have received from applicants. So one of the first questions we received was around, what if we are already an organization that is a beacon of empowerment? What if we already employ women? What if our research is led by women? What if our product innovation is led by women? All of this sounds fantastic. But if we are to make a lasting impact on the community where you work, how is your organization, by setting an example, by ensuring that the women that work with you and for you have an opportunity to make decisions at a larger stage, how will you ensure all of this? What else can you do? So we want you to start thinking about that. Another big question that have been recurring is that empowerment is impossible to measure over such a short period of time. It's true. It's a short period of time, and we don't expect you to, completely change the world, but we hope for you to at least start doing it. And we need to start somewhere. We're looking for a beginning of a conversation. We're looking for what might happen if you start documenting the issues that I discussed. We are looking for you to maybe provide additional training to people who go out and encounter families on a daily basis as they do house-to-house screening. We think these small incremental changes to how we approach our work can actually not only begin a conversation, but also make some lasting impact, even in this short time. So another really good question is around how difficult it is to empower women or anyone, because they're already in such dire situations, that there's so many other factors that beyond TB that may impact how they feel and what they are. But to me, it sounds like the right populations are targeted. If you are working with disenfranchised women or women who are imprisoned or poor, it is difficult to give control or to, you know, provide all of those qualities that we described in one of our first slides to them. What can be done through your day-to-day interaction with this population? What can they be organized? Can they be given some sort of education or encouragement through your TB screening, I guess is the question here. How will the empowerment component in applications be evaluated? So it's a big component for us in this wave, as you know. It will be evaluated just like the rest of your application. So it's given maybe not the same, but similar weight to your general proposal. So if you're proposing private sector engagement, the empowerment component will have approximately the same weight as your as what you're proposing as your intervention. And it is significant for all of the proposals. So for product innovation, for case finding, for treatment outcomes, and for private sector engagement, it's has to be included. There was another question that I'm not going to address here separately that discussed repetition or similarity in some of the empowerment questions. I think, you know, one of the way the application is built, it asks you to go through your approaches and then kind of discuss some of the risks and challenges that you might encounter along the way. So if you think the questions are repetitive, reread them, or say, you know, state in your response that you have already addressed this in the previous section. But I do think that there's a particular question of what risks you see to your, you know, to your plans around empowerment. Should we have quantitative indicators on empowerment? It all depends on what you decide your process indicators are going to be. If you're developing an organizational policy on gender equity and equality, then no, you know, you can't have a quantitative indicator. But if you're getting a certain number of women access to employment or education opportunities, then yes, then you need to have quantitative indicators. Should a special budget or staff be allocated to empowerment? If it makes sense for your project, absolutely. But the focus of our grants is still on TB case finding and treatment outcomes. So we really recommend that empowerment activities are included into your other project work and are not considered a separate item. So a big question on hiring women. When is it okay? When is it okay to use incentives? Should we have them as volunteers? Again, hiring women or enrollment of female volunteers is not empowerment in itself. You have to explain how what you're doing may lead to expanding the horizons for the women who are engaged. If you're considering incentives, it needs to be explained why and whether they will be monetary or you will provide training, supervision, some sort of empowerment, encouraging meetings at the community level, and so on. So I will go over some examples of empowerment and health programming. That was a question from, I think, 2 applicants. PEPFAR's DREAMS program that is very HIV focused has quite a few components that are not focused on HIV and are actually focused on creating enabling environments for young women and girls to take responsibility and take control over their own lives with due support. There's also an example of the USAID supported malaria eradication programs. We will again go over some of these in our resources. So again, another question on empowerment indicators and how to build them and how to structure them, and that there's a lot of challenges. So these indicators really need to align with what you're planning to do in your project. If you're not engaging women at the community level, are you reviewing your organizational policies and ensuring that women from your organization have access to additional opportunities? Are you documenting your work? If you're engaging women at the community, what are you tracking? What are they benefiting from? And so on. And there are some examples of these indicators in our framework that, again, we will go over at the end of the presentation. There is a great question that came in very late last night about working with men to change community perspectives. It's a wonderful idea. However, you know, if you are engaging men and to change community norms, do not forget to, you know, check in with the women at the end in the community and see if there's actually an impact, because, you know, sometimes interventions will train men or, you know, talk about, you know, prevention of domestic violence or attitude change towards women in the community, and then they will do the intervention, then we'll survey the men and ask them, you know, how the intervention has impacted them, but they will not ask the rest of the community at all. So, you know, if that's what you're planning to do, make sure that you know, evaluate the people that are not receiving the intervention, but the people who the intervention might actually impact. So this is the end of the official part of the presentation. I wanted to go over some of these resources with you. So the framework that I discussed is right here on our Wave 7 application resources. If you scroll down, it says Framework for Empowering Women and Girls in TV Reach Grants. And this might look familiar. And it discusses, you know, what can be done, or what needs to be done at each of these points, looking at data and evidence, designing gender responsive interventions, and promoting gender equality through TV programs. We talk about possible interventions, you know, again, just to give you examples. And at the bottom here, we have indicators that programs can, you know, use or adjust. I also only yesterday realized that this list that we have given you of resources doesn't actually work. But if you Google some of these items, you will be able to open the documents. I will rework this document today and make sure that you can open them as PDFs. But for example, if you do this, there's this gender assessment tool from SoftTB Partnership and UNAIDS that I encourage you to review, or at least look at, you know, at some of the questions and approaches. There is a really good document. It's pretty old, but I think it's still significant. It's called What Works for Women and Girls, Evidence from HIV/AIDS Interventions. So again, if you Google it, you will be able to open it. And while a lot of it has to do with, you know, HIV and reproductive health, which is irrelevant, Chapter 11 discusses strengthening the enabling environment. And I think a lot of issues that are discussed in this chapter are very relevant to our programming, and I would encourage you to review it. There's also, you know, I discussed dreams a little bit in the presentation. If you check out their page on PEPFAR, there's a bunch of information about what DREAM's main interventions are and how they're working to serve women and girls. So there is WHO's guide on promoting women's empowerment for better health outcomes for women and children that you can also review, and what some of these strategies are and what they mean. And then we have a wonderful article that was written about one of our grantees, two of our grantees that you can see here, around how to incorporate conversations about gender into your work. So I think some of these can be useful, and it's not difficult reading. This one is actually pretty easy reading. You can also email me. I'm a little hesitant to take questions because there's so many of you, but why don't we try it for a few minutes? So if you have a question, a pressing question that I didn't answer, you can ask it and I will attempt to answer it. No one has questions? Good. Oh, there's some stuff in the chat. Okay. Okay. So no one has any questions, or are people just shy? If you're shy, you can type the question in the chat box.
Hi, this is Gauri from CD Foundation.
Mm-hmm.
I just written in the chat, but let me just say it out. We were wondering if when we are onboarding patients for our technology, our focus is on treatment.
Mm-hmm.
Would it lead to a bias if we focus on onboarding more women? Because we already know that in tuberculosis, the impact on women is higher.
Say it again. I didn't understand the question. I'm sorry.
It's okay. So we're looking at managing, say, 100 patients. I'm just giving this as an example. If we focus on onboarding more women patients as opposed to men, will that impact the study, or is that something which would be okay?
So, but why would you be onboarding more women? I don't really understand.
Because, I mean, the integral thought here is that women, when you're looking at treatment, women go through, in terms of access, in terms of provision and all of that, women have a little barrier to get access to treatment. So we were wondering if we can encourage more women to come on our treatment and get treated. Will that be all right? And will that be taken as a women empowerment aspect?
I mean, this is what I was afraid of. I think it's a very specific question, and my first response is no, because so you are building. I mean, you are building evidence, and you're responding to a certain need, right? So you are, like in those blocks that we discussed just now.
Yeah.
In these three blocks, you are addressing these first two.
Mm-hmm.
Sorry. Right? Because you're looking at data and evidence and you're creating an opportunity for something. Yeah. But I think part 3 is something that you have to think about, right? Like, what will the impact be on empowerment? Can you do anything at community level, as you're enrolling women, as you're looking at the factors that are preventing them from accessing treatment? What are the things that are preventing them from doing it, and is there anything that can be done? So yes and no, right?
Got it. Thanks. Got it. Thanks.
All right, so let me look. I think for the study, can we focus on, okay, so that was in there. Would I recommend a CAP survey? So again, if there's never been a CAP survey, then I guess a CAP survey for what? A CAP survey to establish some of the challenges for women. I mean, it could be useful. I think if there's already some evidence coming from your community, then I would spend my resources and time elsewhere. But if you, Molly, if you want to come on and ask it online. Molly? Okay, does TB Reach expect applicants to have staff who are specifically dedicated to manage, promote the gender component of the grant? I answered the question during the presentation. Generally, no. If it makes sense for your project, you can dedicate staff to this component. But generally, we hope for these activities to be included in your project work. Can we do empowerment without case finding? No. You have to do, again, the primary focus of our grants is on TB. For those who are awarded grants, what support should we expect from TB Reach during project implementation in regards to gender? Stop TB has previously published a language guide for TB communications to stop. Okay. Gender. The guide includes definition of terms gender set, but nothing else related to the appropriate terminology that should be used when discussing gender. Example. Okay. All right. This is a thesis, not a question. Okay, so the focus here is not really on, it shouldn't really be on language per se, but on what your understanding is of issues in the community and how you are connecting those issues with what you're actually doing. I don't think our reviewers will care if you call women females or women. I think what they will care about is if you talk about how dangerous it is for women to walk around the community, and then you propose that all of your community outreach people are women. And that becomes a big discrepancy in what you are stating as a problem and what you're proposing as a solution. So I would not focus on language at this point. I would focus on what it is that you're trying to do, what is it that you know, what is it that you're trying to change, and how you're going to change it in such a way that it makes sense and doesn't pose more challenges to your community or more, challenges to the women or females that you're engaging. Where should we start to evaluate the gender issue without official data and evidence? So I think I understand this question. Well, I think one of the things that you can state is that you will start creating data and evidence. And I think, you can obtain maybe not data, but maybe some evidence by speaking with community groups that already engage women. In the event that we already have women who have been empowered in our programs for financial inclusion, can we expand this, and would it be a component of empowerment in this way? I mean, again, without knowing the specifics of your project, it's hard to say, but if it makes sense for the project that you're proposing, then yes. In our intervention, it will be difficult to expect a uniform level of desired outcomes across the targeted locations. Okay. Okay, so I see. That's a really fine. It's a fair question. So if you're working in several areas and you are you are expecting to see better empowering outcomes in some areas over others, then I would say it's fine as long as you're documenting, the why it's happening and the reasons for what you're doing. Okay, hold on. I lost where I was. How can it be effective in empowering women by supporting their families? I don't know if it's about supporting their families or about and what it means by support, right? Because what some of the things that I started with discussing with you was around, we go into a community, we know exactly what's happening, we know there's violence, we know women can't go freely. Again, there's no expectation for all of you to become, gender-based violence experts, in preparation for these grants. But, what do we know? What can we find out about the community? What can your community health workers do to kind of start conversations at family level around why it's important for everybody in the household to get screened, why it's important for the women to be able to go and take the kids in for testing and take themselves in for testing. So to me, it's not, you know, a family level support. To me, it's discussion with families and also in the community around these issues. Okay. TV Reach seems to be more interested in randomized control intervention for evaluation. Are other evaluation methods discouraged and why? This question has nothing to do with gender empowerment, so I'm going to go, I'm not going to answer it unless you can link it to empowerment. How strong consideration has to be placed for gender and intersectionality in our approach? So again, I think I discussed it briefly. Gender empowerment has a pretty significant weight in how your application will be evaluated. If you have received particular comments from your stage 1 reviewer, you know, focus on them. Again, ensure, I cannot stress it enough. If you are stating issues, I have to say that everyone was really great at stating the issues that women might encounter, but then there was like a missing link where people were struggling to come up with solutions. And that is fine. We get it. You know, it's hard, but we think you can still, you know, draw a logic chain between what the issues are and how they can be resolved. Must we have control to evaluate our intervention, especially for a project with no research component? Again, I don't understand if you're asking about TB notifications, because yes, this is how all of our project, our treatment outcomes, or if you're asking about empowerment. In empowerment, we're not talking about controls and intervention. Control and intervention areas are only important for your case finding activities or your treatment outcome activities. Okay. I think I've answered everything. If anyone else has any more questions, and again, you know, I'm not going to go into our evaluation strategy. I think deadline for round 2, it's July 17th, I believe, but you should know this. You should know this better than I do. Any other questions? Can we change the focus of the women empowerment strategy based on this feedback? Sure. I mean, I think what you can do is when you're rewriting parts of your application or adding to your application, I think this is something that you can state, that you have decided to change course based on, you know, these factors. All right. Well, we're at 45 minutes. I think we've done pretty well. I think if you guys have any more questions, please feel free to unfortunately, I wish the deadline could be extended, but there are too many other people involved, you know, because we have our independent review committee and it's summer and people will have a very short time, and we also have other things. So unfortunately, it won't be changed. Okay, well, thank you all. Please feel free to email me if you have any additional questions or comments. Best of luck to all of you and have a wonderful weekend.